Merci beaucoup, Ryan, pour l'invitation. Merci beaucoup d'être là. C'est un honneur pour moi de venir vous parler, même si j'ai un thème imposé aujourd'hui. Ryan insists that I give you news from Quebec about HIAP. Quebec used to be a good news for public health. I'm sorry to report that our report card is not going to be as stellar. And even though we have the Prime Minister, the Premier is a physician, and the Minister of Health is a physician, I'm sure none of them could cite Vicente Navarro as eloquently as our Minister of Health here tonight. I find it very refreshing. Thank you very much. Of course, being in Ottawa and talking about health and all policy and not bringing up the Ottawa Charter, having made a career in health promotion research would have been a faux pas, which I didn't get into, but also reminding you that this whole idea of healthy public policy was originating in Nancy Milio's motto, make the healthy choice the easy choice. So it started by helping people to make choice, and I believe that what we've heard today brings us way beyond the individual choice, one by one, but really helping people by the million. As well, the ecological model of health. This one is from Dahlgren and Whitehead. There are gazillion of those models. Just to remind you as well that the IOM, the Institute of Medicine, when they were convening an expert panel for what should public health be in the 21st century, they put that at the heart of the public health agenda. And essentially what it says, and that reminds me a bit of our discussion of this afternoon, so should we be in people's neighborhood, in people's environment, helping them with resources, with access to resources with which they can build their health, or should we have national policy that will bring their health? This ecological model reminds us that it's both. It's not either or, it is just both. And finally, to echo Ryan, just to remind you as well that there is some momentum with this health and all policy, with, of course, the Adelaide Declaration in 2010, and as well when Finland was the presidency of the European Union. So it is a movement that is reaching out profoundly. There are 3 experiments that have been evaluated that I would like to present to you from Quebec today. One is the provincial strategy. Ketan Shangardas talked about it today. It's embedded in the public health law of 2001. Our minister is threatening us with another public health law, still to be seen what will come with Section 54 of that new law. That's the minister who I might remind you has just cut one every 3rd job in the public health force in Quebec last year. And he was saying in an interview in La Presse over the weekend that his reform has already started to give fruitful. So we have more physicians delivering more healthcare, but the health question is still in the air. So Section 54 essentially empowers the Minister of Health to oversee the work of her colleagues with the health impact of what they are doing. The evaluation of this policy just showed that it took resources. It took building those resources into the mainstream of the government, so they had to hire people. They had to develop supporting tools and disseminate them, the health impact assessment, and they have to establish collaborative agreement. So one does just not decide from nothing to do that. So there are instruments, and it is something that needs to be resourced and high-level technical results. The challenge that they face, there was a lot of reluctance from other departments. And indeed, after 10 years, out of the 500-some requests that they had, most of them came from the Executive Council, and almost none from economic departments. And it resulted in changes in the proposed policy 20% of time. So, well, I mean, it's a start. I would like to just this anecdote. It's not really in the power of the ministry that this tool was only useful. When l'Auto-Québec, which is a state-owned organization, decided to disseminate more broadly the Lotto machine, okay, it is the regional public health director who, together at the Table Nationale de Santé Publique, who organized the audit of such a policy. And they were able, with evidence-based, that it is in the areas where people are more vulnerable, then these type of machines are creating damage. And at this point, l'Auto-Québec backed up. So it's not just the minister that is empowered by such a law, it's also the MOH in the regions when they have the legitimacy to act and to get together on a social issue. So HIA is one of those tools for health in all policy. And it's a very important tool in which that empowers health to tell others. The problem with HIA in Quebec, it's never been totally mainstream, and it has never been institutionalized the way environmental audit has been, meaning that the public has never had a say about, in the name of health, about the health impact of proposed law. So it is, and it has remained, a totally administrative argument. When we're trying to get closer to people, there are two experiments that I would like you to know about. The first is in Montérégie. Montérégie is the southern third crown around Montreal. And essentially, they have experimented with this health impact assessment tool. And they have provided technical assistance to local health and social services center to partner with municipalities on issues and conduct health impact assessment on projects that were brought about by municipalities. The evaluation of that, which is more of a process evaluation, and again, to echo Ketan, we need impact evaluation on those kind of things, and not only process evaluation. But what the actors in those 5 projects that rolled out across 4 or 5 years was that it was very well supported by people in the municipalities. It was the very high level of health expertise that was felt, that was at the service of other issues, and the power of evidence at this local level was felt very, very heavily. And again, this knowledge was used by people, not only in the instrumental way of this decision needs to be based on this evidence, but in a much more enlightening way in which let's discuss what science tells us about a variety of issues. The other experiment I would like to tell you about is l'Initiative Montréalaise. I've been studying this for about 10 years, and essentially it is intersectoral support of local action. And that's, in a two-way avenue of health in all policy. There's also the other way in which health brings its support to others' projects. So in this very particular project, the Director of Public Health for Montreal decided to join United Way Montreal and the City of Montreal to support Table de Quartier in 29 neighborhoods in Montreal to produce local needs assessment, develop local priorities, and implement action in line with those priorities. So these are social development areas and social development projects that are totally designed, implemented locally with regards to local needs. So the learnings from l'Initiative Montréalaise are essentially that they are associated with observable transformation. We can, if we follow their action, we can see actually changes in the way projects are developed and implemented. But again, tables, they are not entrepreneurs, they are not the one who are actually building the housing projects, but they are the trait d'union, they are the link between the local population and those projects. So essentially, what they produce is four things. They mobilize relevant actors and resources. They make the local citizens' voice heard in the definitions of the project outcome. They advocate for the projects, and they create this local solidarity that was discussed about. So essentially, what I get out of that is that you can do local development, but if you do not listen to people, you run the risk of being totally irrelevant. So the lessons that I think that we can learn from what happened in Quebec is it can and should be implemented at various levels of governance. It's not just up there, it's not just locally. And what we, both locally and provincially, there's a key role for regional authorities there. First, I mean, there's a nexus of resources there and expertise that helps what's happening, and this is essential for what's happening in the field locally, but at the same time, it's a conduit for bringing up the experience, the lived experience of people. I don't know, Madame la Ministre, if you would trust the Parliament to know what exactly the Canadians want and live, but I think that there is a need there for a two-way street. And these tools do not involve direct service. They are areas, they are forum in which people dialogue. And as our Minister of Health now says, they do not provide direct service. Therefore, they were the first one not to be renewed. One of the very important things that we saw as well is that health becomes a broker. And as the medical officer of health and the Director of Public Health for Montreal really often told me, by sitting and by participating in those intersectoral actions, what I do, in fact, is I buy a ticket to be at the table where regional decisions are made. And this is probably a first step for health in society. Thank you very much.